Good morning, everybody. So welcome. That's the first item on the agenda. So welcome, everybody. I think most of you probably know me, and if you don't, I'm Ann Vosbrink. I am the EMS data manager for the state of Arizona. And we have a few other people in the room with us, and I think everyone else is online or running late. And maybe we could just go around the room really quick and introduce, you guys don't have to, but just the bureau side so that, I don't know if you can see Shelly. She's our guru on everything. That makes
My name is Shelly Bissell, and I work in the Bureau of EMS Trauma System in the services section, and I do the public meeting support.
Good morning, everyone. My name is Julia Vinson. I'm in the corner of the screen there, but I also work in the services section of the Bureau of EMS Trauma.
Hi, everyone. I'm Marielle Munchie. I also work in services, and you'll see me helping Ann with some of the data stuff. So,
that's a perfect segue. So let's see.
Leahia's on the line.
Oh, Lihia, can you introduce yourself? Sorry.
Yeah, good morning, everyone. My name is Ligia Castro, and I oversee our licensing management system.
Okay, and is there anybody else from the Bureau online that would like to chime in and introduce themselves? I didn't check who was on. Okay. Well, if there is anybody and they want to say hello later, go ahead. So just a few Bureau updates, nothing that you probably haven't heard in the regulatory meetings that we've had within the last couple of weeks, but I specifically wanted to introduce Mariel, which wave again. Okay, so she is one of our new epidemiologists, which we are super, super excited to have more depth in our section to do analysis and things like that. But she's also graciously going to help me with some of the day-to-day tasks with AZ-PIERS. I appreciate everyone's patience, especially lately with maybe not getting back to you as quickly as you would like or getting something set up. And Muriel's amazing. She's learned everything I've showed her very quickly. It's more on me, the fact that it's taken me so long to put things together to teach her. But I just want to let you know that if you see emails from Muriel or she reaches out to you, she is part of our team, and please get her what she needs if she asks for it. And she's also here to help. So thank you so much, Mariel. We're very excited. I really am very excited. And then a couple quick updates, which I think everyone kind of knows about anyway, but really quick. Article 9, these will just be for CON holders. It's still in process. There's no new updates on it. And although it's still something that we're working on, I think it's kind of on hold for right now while we deal with some other things and legislative deadlines that are coming up January 1st. And that leads into the other thing, also related to CON holders is the HB 2609. And so there have been, I think we had one listening session, I think it was last week, but there will be listening sessions this week of the regional councils. So if you are interested in attending any of your regional council meetings, central, southern, western, northern, we will be having a little run through of an update and kind of an overview of the different aspects as we've seen them, getting some feedback, and then also how some of the analysis tools will be available for agencies to use. Let's see. So please feel free. If you don't know when those meetings are, or you don't have your agency contact rep, are you gonna?
I'm going to share.
Okay, Shelly will share it. And I do recommend a good time to kind of catch up on what's going on with all of that. All right, and I'm going to pause for just a second before I go on to the next item to see if anybody has any questions. Matt's going to stump me because I probably can't answer his question, but go ahead, Matt.
Hey, Ed, sorry, maybe this might be early and you'll speak to it later, but we use EMS charts for our ePCR, and we continue to have data validation errors with them. They have told me that they've reached out to you guys to discuss the schematron and where there seems to be issues on both ends, maybe, and I just kind of want to know that that's actually the case, that they've actually reached out and work is happening.
Can you definitely bring this up again? I don't have a super structured meeting today, so
Okay.
well, I mean, I have an agenda, but I would, if you would like to I'll talk about it now, and then if you could bring it up again when we talk about the schematron a little bit. I did like a little I made a not very pretty, but hopefully instructive graphic about how the whole process works, because I feel like it's just something that is not easy to understand. But yes, I have been working with, well, Zoll, because they own EMSRUG, it actually comes in as Zoll now, but I know that the product that a lot of people are still using, some people are using the actual Zoll product, and some are using EMSRUG, but I have been working with them. It looks much improved for me from what I saw last week. I did just email them. I don't want to go into particulars about your agency on the phone, but
I thought
it
it looked much better.
with them and it looks, oh, Lauren, hey, there you are. Okay.
Hi.
Lauren is from Zoll/EMSRUG.
Yes, perfect.
Just so everybody.
Yeah, we have been looking. I actually looked again this morning to follow up with Kevin to see if there's any additional configuration things. But with the report that you provided, Anne, I thought it looked much better since the data set update.
There's a couple small things that I think, I don't even know if I got that email done, that we can address that I think are just not exporting, but I'm sure the agency is doing them, and that would be a quick fix.
Okay.
And for anybody on the phone, just not to hop around too much, if you are noticing issues with your validation reports that come back to you, and especially, and we'll go through this little infographic later that I made that's nowhere near as pretty as the one Julia makes, then one of the pain points could be that you are collecting it and it's just not in the file that's getting exported. And that can be for a lot of reasons. It can be because, I mean, that was originally how it was built. 3.5 is pretty new, and we did end up having to redo our state data set file that's posted with NEMSIS. I know it's a little technical, but the basic idea behind that is it was refreshed, I don't know, probably like 2 months ago. And if vendors had been using that original file, it might have not been configured in a way that asked them to submit all the right properties, even though our data list is correct. So agencies, what you've been looking at in all of our websites, that's exactly what we're asking for. But if you work with your vendor and you can improve what you think you're seeing coming into our system based on what you collect, once we verify that, you could do it without us verifying it, but it would be a lot of work for nothing. Then you can resend, if you would like, any of your runs from before so that they export the proper information. That'll rerun everything and improve it. So I know it's a work in progress and we're almost in the month of December, but it's pretty normal. It's a pretty big change this time around to have some growing pains. And we just happen to have a lot of other things in Arizona going on at around the same time, including our new licensing system that went online this year. So I know everybody's spread pretty thin, but I really do welcome feedback, and I appreciate Matt bringing that up, because the most important thing I think is not to assume that there's something wrong with our system, or there's something wrong with your system, or there's something wrong the way with your guys are collecting things. A lot of times there's just some little issue at one of the points that I'll mention later and talk about that you can look at that probably addresses 99% of the things that we see wrong. But unless you actually are a direct user within our system, the enterprise license, even if you have image trend, it doesn't matter. Unless you use our enterprise license, I can't see into your system, which is fine. But it means it limits how much I can address or troubleshoot on my own, which is why I have all these other tools. And of course, every vendor that I've worked with has been incredibly responsive and helpful. And if for some reason you feel like you're not able to get a hold of them, I mean, sometimes my contacts change too when someone leaves and I don't realize it. So please reach out and I'm happy to connect you, or we can all get together. I've had calls with vendors and their agencies that kind of, we look at things and just try to figure out what's going on. It's not supposed to be a painful process, even though I'm sure it sometimes is. And then I forgot to ask Julia, do you have any more bureau updates? I forgot to ask you if you, okay. She shook her head no. Okay. Are there any other questions before I go on to just some really quick reminders? Anything like that? Okay, cool. So everybody should be have switched over to V3.5 by now. We do have a couple stragglers. I'm not going to shame them by naming them. Most of them have a plan. There are a few that I have been pretty radio silent. The vendors have reached out. I've reached out. There's only so much time I have to do that. And I've tried Googling even the agency's phone numbers, you know, in case my contacts are outdated, and I don't always get a response. So at some point, those agencies, we're just going to have a hard shut off. We're not going to have any more 3.4 data. So whether they're using the system directly or they're importing, it will stop, because we need to be consistent with the national standard. And we also need to make sure that the data that we're collecting reflects what we're anticipating to show in reports analysis that our stakeholders are using, the hospitals are using, the, trauma registry is using, the cardiac registry. And it's important for us to kind of be all in all one standard. So I feel like we've had a pretty good grace period for at least switching over. Natural have growing pains at first, but if you do not know what I'm talking about right now, please reach out to me, because we do have a couple agencies that I haven't heard from, and I want to help if this is maybe you had a whole changeover of staff and nobody had any idea. Okay, and I meant to send this out before this meeting and it didn't happen, but if you have failed imports for the year, so that this is not just 3.5, it actually also includes 3.4. So even those agencies that have switched to 3.5 this year, there's a couple that switched last year, but the agencies that switched to 3.5 this year, if you have any failed imports that are 3.4, you can still send those. We will still take them because they're older ePCRs. So please, if you're having problems, you don't know how to resend something that's on a different version, I will work with you. Your vendor will work with you. As far as I know, all vendors can send the older version, even when the agencies are on the newer ones. And then same thing with your 3.5, anything that's failed, please resend it. We will be closing our data this next year. We haven't really ever formally closed it. NEMSIS closes theirs usually by the beginning of February. So they will not, they'll take it, but it won't end up in any of their data sets that they do any presentation or major analysis on. We will be looking to start closing our data sets. And I think it's a really good goal to try to get at least any failed ePCRs in that were before December, to get them in before the end of the year. If anybody has any questions on that, or usually when I send out the report, I do a table in there, but it just lists all the possible issues, with the exception of when it says that it's a destination issue where you haven't put in a recognized code. That is something that the state uses the facility ID issued by licensing. And sometimes it just means you might even be using the right code, but if it's not in our schematron, then our system doesn't recognize it, because we have to know where the patient went, or the hospitals don't get the records, and that's a big deal. But anything else that says schematron or schema, those are things that usually, but not always, you as an agency are not going to be able to fix on your own. I cannot fix for you. You will need to contact your vendor and work with them. Sometimes I can tell from the message. Most of the time I can tell from the message kind of what happened. But that's what they're there to help you to do. They will help you do it. And once again, if you feel like you would like to copy me just so I'm in the loop, or you would like to have a meeting with them if there's getting some confusion, I'm happy to. They're really, as far as things that fail, I do not think, because NEMSIS is the one, the National EMS Information System is the one that puts together the national schematron and the national schema. And those, as far as I know, are functioning perfectly properly. So if they're rejecting something, it's not usually an issue with the schematron itself. It's some funky thing, like there's someone sent over text and it's supposed to be a code, and the system knows that, and that's something that NEMSIS has set for the whole nation. So please just keep that in mind. Please get your failed stuff in. I'm going to send out reports this week. And if you have any questions at all, because I have some that I've sent out probably the same 4 or 5 times on this, reports over the months. So please do get those in, because otherwise, not only do I need to rerun that report each time and resend it to you, but it might indicate that, you might need to contact your vendor for a little extra support in exporting them. They don't always export on their own, again, even when you fix something. Okay. Are there any questions before I go on to the next part of this?
I'm sorry.
Nope.
You said closing a data set is a goal.
Mm-hmm.
What time frame are you?
So I know that right now we are planning on running it. Okay, there's 2 parts. We're planning on running some data for 2023 to add some additional information, some geocoding and urbanicities and things like that relate mostly to HB 2609. I always have to make sure I don't say 2906. And that will probably be done about 2 weeks into January. So I don't know if it's going to be rerun for 2023 after that point. For the rest of the data, for people that are like, I don't care about that, that's fine. honestly, my goal is probably, I'll check with when NEMSIS is closing it, but when NEMSIS closes it, I really would prefer that we are also closed. It makes a lot of sense that we can match, as you can understand what they're doing. And that's generally February 1st-ish. So if we can, whatever that weekday is, that would be a good deadline for us to try to close it. There's going to be exceptions and things, and we've always taken older data for an agency that like just started sending us data. Maybe they collected on their own before, but we really don't have any of those right now. So let me know if you have issues or questions, or there are a couple agencies, I don't know if they're on this call, that operate in 2 different states. And if that is an issue because you're sending one data one place and another data someplace else, and it's causing a problem with who's accepting what, please let me know, because I work really closely with the states surrounding Arizona. Oh, Chris, do you have a question?
Yeah, hey Ann. Just speaking of the version 3.5 stuff, I just got an email from ImageTrend saying their continuum, they weren't able to update it to the new 3.5 data sets. I don't know if anybody else on this chat or if you ran into this, because our continuum's not working with that new e-disposition dot whatever, 27 through
27, yeah, 31.
through 31. Yeah.
I don't know if anybody else would like to discuss that. We have a continuum with the state. I haven't opened it up to everybody to see their stuff yet, but we definitely would want to have it available for 3.5 data before we did that.
Yeah, so I just sent him like an email back going like, hey, like, did you guys just drop the ball on this or what happened? What happened?
Okay, yeah, I mean, and I
So-
have Chris, if you want to, I mean, I don't know why agencies, they could just delete it if they're not interested. If you want to send me any follow-ups to that, I have an email like group that's just agencies use ImageTrend, so everyone else doesn't get spammed with stuff for ImageTrend. I try to kind of have
Right.
their vendors so that I don't send way too many emails on things that are unrelated. So if you want to send me that, I can send it out to the other ImageTrend users. I don't know how many people have Continuum, but you can just say at the top, if you don't, then just ignore this.
Thank you.
Sure. Oh, and then Conrad, do you have a question?
Yeah, and just wanted to clarify, when you say that they're closing the data sets, that's specifically for 3.4 data sets will no longer be accepted, correct?
Well, okay, that's a good point, actually, because I think I didn't make that really clear. So yes, 3.4 will absolutely positively not be accepted for any incident dates, probably past mid-December, honestly, because I don't wait till the first of the year. It's always such a mess and nobody's around and we're not all around. And but as far as data set closing, there's this kind of concept, and we do it with a lot of registries because this is actually a patient registry. There's a certain point in time where you kind of say, okay, everybody should have their stuff in for the previous year, no matter what version it is. Everyone should have their patient records in from that previous year. I think we'll still accept updates, but as far as new records, we want to be able to say this is the 2023 data set. This is what we have. It really allows a lot of that more complicated, really cool information that our bureau is able to put out using that data. Really requires them to do a lot of analysis with it and creating other things. And they call it manipulation, but it always sounds bad. But and to do that, it means that we have to kind of say, okay, this is the data set, and not kind of have stuff keep coming in. But we'll try it. We'll see what happens. It's just a disaster. Then we'll just keep taking 2023 data farther into 2024. So not related to 3.4, 3.5 exactly, but just in general, if everybody can kind of get their stuff mailed in for 2023 by early 2024, it just kind of helps us move on and focus on that and not continue to focus on things that are further and further in the past. Does that answer your question?
Yes, thank you.
Okay. Okay, so I'm going to pull up something in my phone. Well, actually, yeah, let me pull it up first because I just realized it's just a link that I put in my notes. So. And actually, Shelley, if I put the link in the chat, that's probably what I will do, if that's okay with you. Okay, and I know I've shown this before, so let me copy this into the chat. You're welcome to follow it. It's a public link. It should be available to everybody. Okay, and if you don't, I don't know what firewalls, if somebody had, if some reason your IT does blocks these sites, then I'm just gonna walk through kind of what it is also, and you can see it on the screen. Thank you. So essentially, I know that our heads are full of 3.5, and it's really hard, and almost sometimes you just don't want to think about the next step. I've talked about this at the last meeting. There are minor changes that are being reviewed for 3.5.1. Usually these are things that usually it's minor stuff, like the word needs to be changed in the data dictionary, or there's really a value that could be added that isn't there that would be useful, things like that. Right now, this is the site. If you bookmark this, if you were interested, you can see exactly nationally, because this is all decided the NEMSIS level. It includes feedback and state feedback and medical directory feedback and many other entities, including NTTB, which is the trauma registry, and CARES, which is the cardiac arrest nationally. But kind of looking at suggested changes, pain points, things people are suggesting. So anyone can put in suggestions. And this is where they're all posted. So a lot of them have been rejected. It doesn't mean that if an agency really wanted to do one of these, they probably could work with their vendor to build something, or there's a custom thing they can collect. It doesn't mean you can't. It just means they're not going to change the national standard. But all of it's collected here. So if you look through this and you have a comment or are in support of something or have a case, they're always looking for what are they called? Not case definitions, case scenarios, something like that. I can't remember the word. To illustrate why this is needed or not, because with those, it's kind of helpful if you really feel like something's important to illustrate why it would be important to have. You can also look at what is right now being suggested, and you can send a message to NEMSIS. Please reference the ticket number. So like there's a number, an individual number with each and every, thank you. Yes, the key.
Here?
Yeah. Idea. And you need to reference that if you email them, but you can, put in your input. They're absolutely looking for EMS agency input. They just don't get a lot of it sometimes. And if you have a new idea, I think for the minor changes for 3.5.1, they're probably mostly closed now, believe it or not, because it takes time, not just to work this stuff through, but also then once it's worked through and approved, then it has to go to the vendor and they need time to build it. So there's just this kind of lead time. But for 3.6, I know we all probably think we'll be retired by then, but in case we're not, and we probably won't all be retired, because there's a timeline on the national website, but they're already kind of taking ideas for that. So as you all work with this 3.5 data set, and you find something that, yeah, maybe there's a way to do it, but it's annoying to do it that way, or you feel like something's missing that needs to be there, please do put in ideas. You can email them to me. You can email them directly to, I'm going to copy this into the chat also. I think it had it in my last, Jennifer Correa, she works at NEMSIS. Yeah, some of y'all may know her. So, and then there's also I have the link. So I'm going to go into the help desk link, and then I'll copy that into there too. And I realize right now you may be like, I have no idea what I would want to put in that request, but if you bookmark them or put them someplace you can find them later, and you're annoyed with something, you're absolutely, you just can tell me, but or pass it on to me and I'll email it to them. But this is a place that you guys can control and kind of control your own destiny with this a little bit, put your input in there. Like I said, they really want EMS agency input, and I don't think they get a lot of it. So if you feel like being a national influencer, this is a really good way to start. Okay. So that is where you can go to look at what the changes are kind of in being requested. And then, some of them are kind of you look and you go, I don't know why someone would want that, but there probably is a reason somewhere, and not a lot of them get through either because they're, we don't want a huge burden on everyone. It really needs to be something necessary. But it never hurts to put an IT in there. But please do put an example of why you would want to. I think that's really helpful because we'll read them out loud and everyone will kind of discuss them. Okay. I think that's it for the reminders and updates for 3.5 right now. Before I move on to the next item on the agenda, are there any questions? I'm kind of excited that this many people so far have talked in this meeting. I think this is like a record for the last couple of years, and it really makes me happy because I really don't want to I don't even know if people are awake otherwise, so this is good. Okay, so this isn't super fancy, but I have a PDF in the thing if you can show the EMSRUG survey results. So
Are you sharing your screen?
I am not. Do you want me to?
Sure. Or I can, if it's in that folder.
It is in that folder. Can you do?
Okay.
I haven't closed all my tabs.
I don't find it.
And I'll just, it should say summary, EMSRUG summary agenda. So I sent out a survey by, in Google Forms. It was pretty short. We've had the same format, 2 hours long on a Monday, from 10 to noon for a very long time. And it seemed like it was time to kind of get feedback and see if there were some changes that were wanted by the community. Maybe a different day, maybe different times, different format, more often, less often. And so I sent out that Google form. We had a couple weeks to fill it out. We got some feedback. So I'm going to go through just really quick the sum up what the results were, and then we'll just really quickly go through the different results. So it looks like the winner is still to have them quarterly. Thursdays actually look best. Tuesdays and Wednesdays were actually pretty close, and we'll see that in a second, but not Mondays and definitely not Fridays. We will definitely not be moving it to Fridays. We will be moving it away from Mondays, and Thursday was the most popular. So we'll see if we can find a Thursday slot that works. Also, the best time range was still considered 9 to noon. So we'll probably just do 10. The duration is going to change to 1 hour, which is fine. And then we may have breakout sessions afterwards for specific topics, or, there was either related to one vendor or one issue or whatever. So I don't know, we'll do 10 to 11 probably instead of 11 to noon, but I'm not sure. And lastly, it also was advised that it's better to try to schedule them all year in advance. And I would rather cancel, one than not have people available because it wasn't scheduled in enough time for them to fit it onto their calendar. So yeah, Shelly's going through the questions and these nice graphs that I did not make, but are made automatically, so I thought it's kind of fun to share them. And if you did not get to be part of the survey, I apologize. If you did not ever get this email asking you to take the survey, please let me know, because I have a huge email list of, I think it's like 600 people that I send it to. And if you didn't get it, it likely means that you aren't on my list for whatever reason, or I have an old email. Maybe your municipality changed their email structure or something. Okay. So I don't know if anybody has any comments on that, but that'll probably be the plan for the next meeting. We'll start scheduling them out. They'll be quarterly, probably Thursdays for an hour. And if we do a subject specific part, it'll probably be right afterwards, but there was a fair amount of people that also like the idea of having it on a different day, just completely different meeting. We can try a couple of those two and see what is more preferred and we get better attendance at. Okay, so update since the last EMSRUG. Leahy is on the phone. I'm going to turn it over to her in just a second. And then after that, I'll talk a little bit about where, I don't know if you guys are, hopefully most of you are familiar with the share registry, but kind of how that's going, because it's being moved from the U of A back to the Arizona Department of Health. So just so you have like an idea, if you talk to your hospitals or if there's hospitals on the phone. So Leah introduced herself earlier. She is in charge of the new licensing management system. That is the one that went online this year. That's the one that has several different functions, including, I think you go there for your training, you go there for your EMCT stuff, rosters, vehicles, things like that. So she's going to talk about a really important task that we need y'all to do that has to do with our very near syncing up of some information between the licensing management system, the rosters for your agency, whether you have a CON or not, and AZ-PIERS. So they'll all talk to each other. This will be like a one place where you go to update personnel, for example, and it will sync over so that we don't have this mismatched information, certain numbers that are wrong, things like that. So Lihia, would you like to?
Yeah, I'll take it. So good morning, everyone. Like Anne said, we'll be merging or syncing LMS with Elite. So something that's going to be really helpful for us is if all the providers can go into the system, and if you don't have an account, I'll show you how to create the account in a second. But if you can update that, and then if you can go in your agency and update the roster, that's going to be really helpful for us. And it's also going to be really helpful so we can get an idea of where the EMTs are currently working at. So that will be really helpful. And this is more like a hands-on training. So if you have any questions at any point, please just let me know. So the first thing when you get into the website, you're going to see your login page to our public portal. In here, talks about some of the services that we have within the LMS. We also have some user guides and some videos that are going to be helpful, and then hopefully pretty soon we'll be having a video that's going to have the steps that I'll be sharing today. But the first thing that you need to do to access our LMS, our licensing management system, is to create an account, and you can do that by clicking on creating an account. If you had an account in a previous system, you can reclaim your account. And then I have a quick video that's going to show you how to do both of those. And then this video too as well is on our site. So it's going to be creating or claiming an account. So all right. So that's how to claim your account or you create your account. So once you're in the system, we have to actually give you access so you can access the provider section. If you are working with any of our coordinators, regional coordinators, you can reach out to them and then they can give you the role. But once you have the role of a coordinator or to have access to the roster, you're going to click on provider. We have different options in here. So if you're an EMCT or if you're submitting an application, this is more for our licensing side. You click on applications and then you'll have access to those. If you click on education, that's more related to our classes that we have currently going on. But then if to update the roster and to access everything related to your agency, you'll click on provider. Once you're there, if multiple people can have multiple roles, and you can also be attached to several or more than one provider. So you're going to look for the one that you'll be updating the roster, click on that name, and that's going to give you a menu. So you're going to see here you have different tabs. The one that we're looking for is the personnel. This is the tab where you're going to be updating your personal records. Once you have them in your roster, you can also view their EMCT cards. You can request an EMCT card for them, so you can do all of that. But to do that, they do have to have an account in our system. So you're gonna look for their name under personnel, and then you're just gonna click add existing personnel to your provider. And then once you do that, they'll be on the list. If you have some, go ahead, Chris.
Yeah. So, just quick question. So if they're already in our Image system with their, their Arizona certification cards,
Mhm.
is it gonna auto-populate all of them, or do we gonna have to do this individually?
You're gonna have to do it individually.
Ah, man.
And then I know also if you, I know we had our legacy database. If you had them in there, I know they migrated with the system, so they should, some of them should be in there. But if
Okay.
not, you're gonna have to do it.
So they have I guess they have an ImageTrain account, right, and DHS account, and
Yeah.
but it won't migrate the two together.
If they were, so if you had them on the old system in your roster, they will be here. But if they were not, then you have to add them there yourself.
Oh, okay. So they did come over, most of them.
Yeah, they did. They did. If they were in the older system, then yeah, they should be here.
Okay.
That depends on how old your roster is and how the last time you updated it. I know some agencies that just happen to be in discussions about something else, and I've shown them their roster. We're kind of laughing because it's almost completely outdated. But if you're one and you're in the previous, what we call the legacy system, all of that was copied over, so it was correct in that system. It should be correct as of when, like, what was that, March or April?
Yeah, April. Yeah.
And maybe you've
Okay.
already gone in here and updated this too. I mean, I'm sure some people have.
Yeah, no, we had Academy graduate in June, so I'd probably have to add those
Yeah.
20 guys or whatever.
Yeah. So after April, you'll have to add or remove them.
Okay, cool. Thank you.
So speaking of removing, so if you want to remove someone from your roster, it's very simple. You're gonna have the list of everyone in your company. You just click on one of the boxes. You can do multiple at the same time. You can select as many as you want. Just click on the box. There's gonna be at the bottom. There's gonna be a drop down with different options. You just select remove selected users and then click go, and then that will remove them from your roster. It's very simple. Like I said, once you have access to this page, you just look for them, add them, and then on the same page, you can remove them. And then under documents, you can see their EMCT cards if they have requested one recently in our system. So you'll be able to do that. Or you can request their EMCT cards for them if you want to do that as well. Any questions?
I have a question. Hi, this is Dan Jarrett from Daisy Mountain Fire. Is this, are these slides available online anywhere?
We'll make them available.
Okay, thank you.
Great question, Dan. I was gonna ask the same thing.
And I know Rachel wants to start sharing the slides on the public meetings that we have as well, so everyone has access with them. And then I'll get with Julia too to see if we can create a video so we can have on our LMS public portal page as well, so everyone can access them.
Yeah, and maybe there's some place we can post it on the public ADHS website, and maybe I can even post it on the AZ-PIERS public website with ADHS, which I know I'm always telling you guys to go visit that because that's where I put everything. I even look myself for things there when I need to find them. So yeah, if you know, it's not, it really does look pretty straightforward. I think even I could figure it out.
It is.
Familiar with the licensing system. But it will save a lot of work because anything that's in there when we start syncing things over, and I don't know if we're gonna do it probably with either an agency at a time or a group of agencies at a time. I don't know how much outreach we'll have to contact the agency, make sure the roster's updated. But once everything's over, you can't undo that, and then we need to go through and dedupe, inactivate.
Mhm.
It'll just get so much faster if we can start it this way. And I think there'll be some really great benefits. We've talked to other states that have both of these systems, and there's a lot of features and a lot of parts with when you have already the AZ-PIERS system we've had for, I don't know, like 12 years. We just got this one that are a pain when you don't start these at the same time, which we did not. But all of the states we've spoken with, there's a lot of work to get this going. But once you do and everything talks to each other, it's apparently very helpful, exciting, efficient, causes less work for everybody, and means that everybody has hopefully the updated information. But there'll be more outreach or education about some of the how this is going to work in the future. But this is one thing you can really do to
help us get there.
Yeah.
You can also update the. Well, you can also see more details about the agency and if you have a license too as well.
And Lihia, who should they reach out to if they have questions about this? I know that, Sarah, I believe it's not yet. Oh, wait, which website? You mean the AZ-PIERS ones?
The one to get to the roster.
Hi. So I can't see that licensing system or itself. Okay, we have a URL for the actual web, and then we also go ahead.
I'll share it.
Okay, so Shelley's going to share where the actual URL is to go to log into and claim your account for the, I call it the licensing and LMS system. Sometimes people here at the Bureau will call it the EMS and trauma portal.
She had it there on the beginning. I just
Okay,
couldn't
great.
copy and paste it.
And then a lot of times we'll end up referring to AZ-PIERS as elite. You'll hear that a lot, or the EMS registry. So I apologize. We have so many different terms. They're all correct. Thanks a lot.
And just
Yeah.
real quick to one. So we also have the hospital site that looks exactly the same, but it's just for trauma-based hospitals. So if just make sure you're using the licensing.
And that is totally different than the hospital portal that you use to view your ePCRs from the agencies.
Yes.
Yay. But it really will be a lot better because everything will kind of look the same, sync the same.
Yeah.
And we'll be able to get a lot more information out that we used to get questions where it really seems like something we should be able to answer and we couldn't with the old system. It's not that the old system was bad. It just wasn't originally built for the purposes we expanded it to do. So this should allow us to start answering some of the basic questions that, are really important in general, but also during emergencies and, when there's staffing issues and things like that. So, okay. And if you guys didn't see that, I did a little shit. Okay. So Lihia, do you have anything else to add?
No, that was it. If there are any other questions, just let me know. I'm here to help.
And thank you so much for doing that. Let's see. The next update is really just informal, and I might have Julia, if she thinks of anything, she is an update. So we have been working to set this up. Most of you are probably familiar with SHARE. SHARE. If you're familiar with CARES, CARES is the National Cardiac Arrest Registry. SHARE is the Arizona version. So it's not connected to CARES, but it's the same concept. We collect data from EMS agencies who have out-of-hospital cardiac arrests. And we collect that in AZ-PIERS, obviously. And then SHARE collects from cardiac receiving centers in Arizona, cardiac arrests that have come into the hospital. And I don't believe it's just through EMS. Like if for some reason somebody was brought in POV, I think it would include that too. And Mariel's nodding her head yes, because Mariel was new and we all had a lot of projects and we're like, Mariel, would you like to add this to your plate? So she's a good one to talk about it too. And I've worked a lot with the cardiac arrest data and we have in our Bureau, but since I have been with the Bureau, this registry has actually been housed at the University of Arizona through a contract, which is fine. They did an amazing job. You guys probably know Dr. Spate. He was one of the ones that worked with that somewhat in addition to, they still have the EPIC, which is traumatic brain injury project. So they still have that. But the SHARE registry, for various reasons, it used to be within the Bureau, I guess. That was before my time. And now it's moving back in. So not really a huge change, just kind of a shift back. it makes sense to have that registry housed within the Department of Health. It's really a public health registry, and all the other states I know of, it is housed within there, but it wasn't because there was any problem with U of A. Honestly, they're amazing. It just made more sense to move everything under one roof. The data is just a lot easier to use data that way when it's not spread out under different departments and heads. So that registry will be moving. It really will not have any immediate impact, we hope, on anybody that uses it. So the current way that hospitals enter data that are cardiac receiving centers into what is called CEDAR, that's just the name of it. It's like CEDA, but it's like got a weird little A or a little A or something. But that one is where the hospitals enter data. EMS does not interact with that database. You don't have to worry about it. Just if you hear the term CEDAR, that's where the hospitals, it's an online registry, and they go and actually enter their information into it. I don't believe it's like a feed where anything's uploaded. They actually enter the cases. And then that data is taken by the SHARE program, the SHARE database, along with the EMS cardiac arrest data that you all send us. You know, that's one of our time-sensitive illnesses. It's a really big deal. I personally have been affected by, not myself, sudden cardiac arrest, but my husband and I. It's such an important program. We're very, very passionate about keeping it high quality. So we're moving as quickly as we can, but we also want to make sure that it's done right. Where the hospitals enter data right now, I believe the old URL will be forwarded, so take you to the new one. I think there may be a new one that you eventually want to get. It's going to look exactly the same. We're actually using, it was a homegrown entry program that lady named Karen, is smarter than me by far, made. And so we're standing that up on our servers now on our side, and hospitals will enter. I'm looking at Julie to make sure I'm getting that. Hospitals will enter data in through that, and it's going to look the same for now. Down the road, we may end up looking at different platforms, something that's got different features or whatever, but for now, we're not going to change that. There's a big enough change with moving everything over and trying to move all the knowledge over that has been challenging from the other side, not because they're not helpful, but because we're just not absorbing, I think, at the rate we would like to. And as far as the EMS side, so aside from if you guys have contacts that you have been working with at U of A related to share data, whether you're a hospital or your EMS, those will be changing. Actually, they already have. And I might ask Julia who they can contact if they have questions. But thank you, Chris. That was very nice. You get a star. If I had brought cinnamon rolls in today, which I did not, you would get a virtual one. But I used to bake for my meetings, but no one shows up in person anymore. So we would just be eating them, and that would be pointless. Believe me, after Thanksgiving, especially. So we'll have some new contact people. We're really, really excited to have this back. I can't tell you guys how important this data and how it means to me personally. And I know that Vatsal Chikani, which you guys probably know from meetings, who does amazing dashboards analysis, it's one of her favorite things to work with too, because it has this direct impact on people's lives and the lives of their family members. Not that other stuff doesn't, but yeah. I'm sure you guys in the field know exactly what I'm talking about. So, so that information for at least, I don't know how many years now, not initially when we did the AZ-PIERS registry, but for the last few years, the EMS data that you all send us, the EMS agencies send us and put it into AZ-PIERS, that data is extracted and given directly to the SHARE program, which will now be in-house. So it's really, really important. We absolutely use it. And that's going to continue to be our plan, is that there won't be a separate thing. Some states have something separate that EMS enters separately into that and collects data. But our plan is that the EMS agencies won't have any change either. Their data will go from AZ-PIERS directly into the SHARE program. The only difference might be is because SHARE at U of A was blessed with a larger staff than we have. It's just the way it is. We're going to try to optimize and make it more efficient. So we may be changing some of the validation rules. Don't worry, there'll be plenty of warning in AZ-PIERS to see if we can clean up some of the issues where things are nonsensical because it takes someone to either follow up or it just is something we can't use, and then more data that doesn't make any sense or isn't coming over correctly. Like I said, when we talk about pain points and where things might actually be affecting the data that you know you're collecting and you're spending a lot of time on, that might actually be where we find a lot of our value. So to sum up, SHARE, moving back to the Department of Health, EMS shouldn't see any change. hospitals at first won't see any change except for possibly a new URL. And then we're gonna look down the road at, you know, if we were gonna keep the same homegrown system or not. Hold on just a second, Matt, and then I'll get to you. And after Matt's question, I'm gonna ask Julia if she can share if you have questions, EMS hospitals. I don't know how many cardiac arrest receiving center hospitals are on this call, who you can reach out to for questions. Matt, do you have a question?
Yeah, I'm just curious if you guys have an idea of what we can expect to get back from Share or from the.
I love
state
that question because we've actually been wondering how much you've been getting back and what the value is and things like that. Julia, do you have? I'm looking at you just because I think you've been in on some of these conversations.
Yeah, I was just gonna say before you asked that question that one other potential setback or drawback is that there probably will be delays in any reports that we're getting out to you, and they might not look exactly the same, but I don't think we're far enough along in the process to determine exactly what every agency will receive. That's fair.
And I know there's been discussions too with like Vatzel and Gail, Dr. Bradley, our medical director, and other programs of really enhancing these reports and doing a lot more with them once we get our feet under us. Go
That was
ahead.
another thing. Yeah, I think one of the TEPI meetings recently, a share user group was formed to kind of discuss that very topic of what should go in the report and how they can be improved. So I think all that to say, there might be a delay in getting reports out to you. There's definitely opportunity to contribute to improving those in the future. I know that wasn't a direct answer, but
And how can the agencies, or is it through the regions, how can they maybe participate either that work group or talk to maybe, I don't know if there's regions participating or how is that, do you know?
in that work group, we've had to reschedule it several times, so it'll be a public meeting and we'll post about that online when that happens. If anybody has any direct comments or feedback, they're always welcome to reach out, and I'll ask Shelley to put my contact and you can just put my contact.
You know, will this go up via Gov Delivery, that work group, or do you know how? it's-
Yeah, yes.
Okay, so if you guys are not already signed up for Gov Delivery or you have no idea what I'm talking about, I think in my email salutation, it actually says, don't miss anything, click here, sign up for Gov Delivery. So really do sign up for Gov Delivery because we try to send things out multiple ways, but it's much better to get things 3 times than not at all, which sometimes can happen if it doesn't go out through a certain channel. So Gov Delivery is awesome. I'm signed up for our own Gov Delivery just because that way I know what's going on if something doesn't happen to hit the group I'm in. And it sounds like that group that's based out of TEPI that's going to work on the future of share reports will be a public meeting, and the announcement for that public meeting will be sent out via Gov Delivery. Okay, does anybody have, Matt, does that answer your question? And then also, does anybody have any other questions?
Yeah, sounds like it's probably good enough for right now. Thanks.
Yeah, Matt, it's a very high bar. Okay, so Matt's gonna be on the group. Sorry. Okay. Julia, could you mention who they could contact in our? Okay.
Shelley put my email.
Shelley's so on top of things. Shelley,
Or Adam or Mariel, any of us.
Okay. So please, yeah. And if you know, like if you're emailing Julia and you're saying this is a question about share, she may forward it on to someone else that's going to be the point of contact, but you can always email Julia and she will get it to the right person. Same thing with me. You can email me and I'll try to figure out who it goes to. We're used to that kind of stuff. Occasionally we get calls that are absolutely completely unrelated to what you do, but we can at least try to hunt down somebody who can answer your question. Okay. So where are we at? Oh, just a couple other updates as far as things that have happened since the last EMSRUG. 2 things are in progress, but there's nothing that I have to show you at this point because there's other stuff that I took priority on right now. But we discussed the last meeting. It was related to, I think, when I ran this report for MDC, maybe Medical Directors Council, where we had all of the medications displayed that were given by EMS for the last 2 years, by frequency, not frequency times given, but how many EPCR or how many patients at least received that medicine once. And we noticed there was a lot of cleanup procedures. Also, I didn't do a report on that for the whole, one of the statutory meetings, but just looking at them, there's some weird stuff on there that is not at all EMS related and likely didn't happen. There can be some legitimate reasons for that, but it's probably an issue with something being sent that's not accurate. Sometimes it's test records that didn't get deleted, whatever. But one of the things we talked about in the last meeting was it might be a good idea to have some reports by agency, so y'all are aware of what's being sent in from your agency. Not that you're necessarily doing these things, but what's being sent in, that is what's reflected in our data, and that is what's going on nationally and everything else. A lot of agencies, I'm sure, would want to clean that up. So that's in process. I'm working on getting something set up for those. It may end up in the new continuum system. I'm not sure. And then we also discussed a little bit trying to come up with not a super set in stone, but a good list that everyone can pretty much agree to use for the standard things that we see a lot in impressions and things like that. There are so many codes for impressions, as you guys know, and a lot of times there's 35 codes that mean essentially the same thing to EMS. So if we can agree a little bit more on what our core ones are, it makes just reporting a little bit easier. It makes it less work for whoever's trying to set up your system on your end if you don't use the direct system. Otherwise, I do the pick list. So, and then also it allows for analysis to be a lot easier. And sometimes the codes aren't. We can tell when we look at it, it doesn't make sense. It's close and we know what you meant, but it's not actually probably what it was. It's not like follow up on something that happened. It probably was the actual thing that happened. And some of those codes get a little complicated. So that is something that we're still looking at doing. That is on, I guess, probably 2024, since we're almost in December. Does anybody have any questions before I move on to just a few reminders, which we've kind of already gone over some of these anyway, which is the next item. Okay, great. So key deadlines and timelines, just a couple reminders. I'll say, I'm going to repeat this part and then the next part's new. So the part I'm going to repeat is, please, please, please get in your failed stuff as soon as possible, just so I don't have to keep hunting it down. You don't have to keep hunting it down. Please get in your 3.4 fails. If there's any from earlier this year, we will still take them, even if you're on 3.5. If you don't think you can send them, we'll work with your vendor. But like I said, all vendors can resend those 3.4 records, even if you're using 3.5, as far as I'm aware. Everybody that I've worked with, they've been able to do it. So if you think they can't, maybe that's old information. Maybe that's something that maybe when they first got set up, you couldn't, but you can. So we definitely want to address those. We want to get, at the end of the year, we want to have as much data as possible. Remember that the guideline has always been for AZ-PIERS to submit your initial ePCR within 48 hours of unit notified by dispatch date time. Doesn't mean you can't send another one later, it'll overwrite it. But that initial ePCR is super important to get in within 48 hours because that's used not only by the hospitals, but it's used for all kinds of syndromic surveillance. I mean, I'm sure you guys can imagine how important that data is and how timely it is. And that's a huge win for an EMS database because although a lot of EMS databases are real time or close to it, a lot of other data sets that we have are not. And that makes EMS data, if it wasn't already amazingly valuable, even more valuable. NEMSIS has a policy now where it's within 24 hours of, I think, back in service time, but I don't use the back in service time because if you guys are familiar with the different EMS systems in Arizona, not everybody uses that time in the same way, especially fire-based EMS. So we just go 48 hours from unit notified by dispatch. So if you didn't know that, now you do.
Is there any enforcement on that?
No, because it's a guideline. So, I mean, nothing's no completely. I know with Article 9, I'm sure that'll eventually go through and that'll require at least CON holders to do that. Air agencies right now have to do it within 48 hours. That reminds me, by the way, if you're an air agency on this call and you aren't getting reports from me, that probably means you're not submitting and you all have to be submitting if you're licensed in Arizona.
They're gonna change from in a timely manner to the time frame
if they're a licensed agency. So most transporters in Arizona are CON holders, but not all of them. So if you're tribal or industrial, I don't know if that's technically, but like a lot of them do though. I know it sounds daunting, but honestly, when I've run reports and I can run one, I've done it before for various meetings in the past. Almost all the agencies are already doing within 48 hours. So, and we can talk later if you want.
Yeah.
But for the most part, it is industry standard. I know that sounds a little bit snotty, but it is. Like nationally, that is absolutely why NHTSA, which is the National Highway Traffic Safety Administration, that's a mouthful, who's in charge of NEMSIS, the National EMS Information System, which is under, so NHTSA is under the federal government. They have a lot of directives. They're trying to get a lot of money for EMS. There's a lot of grants out there that y'all can apply for. There's a lot of money available, but a lot of this is tied back to traffic safety, and a lot of it's tied back to the importance of data, which means focusing on them getting the data in a timely manner. Let's see. And then also, I don't know if it'll be ever tied into the Premier EMS Agency program, but I could see that being a possibility because it is, like I said, a key thing to get the data in. But if you guys are scared, I swear to God, almost all of you are already doing it. You just don't realize it. There's a couple agencies that aren't. And it might just be more tied to something else that we talked about before that I think I'm going to talk a little bit about again in a minute. Check your export criteria. You probably don't set it, but you probably tell your vendor what you want in it to set it. Somebody might have done it years ago and you have no idea what's in it because that person's moved on, or you did it during implementation, or it was just a default. There's nothing wrong with that per se, but if your data is not getting sent in a timely way, or if you're hopefully checking those reports that you get every week, hopefully you're getting those reports where it's runs per month and you're noticing there's like a lag or your stuff's not in there, that probably means that your export criteria in your system. So I know if you have EMSRUG, I know where you can find it. I don't know in Zoll or EMS Charts or, ESO, but I'm sure that there is a place you can contact their support and they'll absolutely show you what criteria your ePCRs have to hit before they send. It's super, super important that you set a default so no matter what, eventually it sends. A lot of people have criteria, they don't even realize it, that are set to say, okay, you have to make it ready to be billed and this. Well, if that never happens, your stuff never sends. So you have to have a kind of like a set the criteria you want and then say, or within 48 hours, send it. Just a reminder. But that's something that also in my 2024 projects, I really want to do some active involvement on EMS agencies and vendors, making sure that we have that set in our state. And the expectation is those ePCRs are sent to us within 48 hours. You can resend it. And that's something else you got to work with your vendor. If your vendor's not set up to resend stuff when you change it, then that's something that should be a priority also. Okay. That was my lecture for the day. The other key timeline deadline is, as I mentioned, everyone should be on 3.5. We're going to do a hard cutoff for anybody that's still lagging behind. And my expectation would be, and if you feel like this is unreasonable, then please send me an email because I haven't heard anything back that said that this was not what we were going to do. Everyone will be using the new updated trauma triage guidelines. They've changed nationally. They've changed for you guys. The ability to collect them with the new data points has been available for a while, but the expectation is on January 1st, unless, like I said, someone tells me there's a really good reason otherwise, is that everyone will be collecting it in the current format, not using the old guidelines. But if you have an issue with that or you feel like I'm missing something, please do shoot me an email. You can, maybe I'm wrong. Are there any questions on that before I go over to the next topic or next item on the agenda, number 7? Am I talking loud enough and not mumbling? Sometimes I talk fast and mumble. All right, let me know. Okay. So the next item will probably end up being a standing agenda item, but I just wanted to put something out there. I'm trying to find tools to make it easier for you guys to solve your problems or pinpoint what the problem is without necessarily needing me. I love to be needed, but there's 160 agencies and I know that I just don't have the bandwidth to be able to follow up with everybody. And I don't want to be the reason that things are painful or not getting addressed. And if you can find the issue or try to figure out what's going on, a lot of times that makes it a lot easier when you interact with your vendor because you can kind of say, hey, I see a problem. I'm noticing this is happening. So let's go to can you pull up the graphic that says like, I think I called it ePCR life cycle for lack of a better term. And then I'll show you another document. And both of these will end up getting posted on our website unless y'all find out there's something in there that I need to fix, clarify. I can always fix it and clarify and repost it again too. So Shelly's going to pull it up. I'm going to simultaneously put it on my screen so I can actually see it. Okay. Can everybody see this? I promise it's not so bad. I might do different colors. I tried to make it kind of thematic where the agency side was all kind of orange and yellows. But, all right, so Matt Shaw brought up earlier just a question of kind of about data and schematrons and things like that. And it has always been, honestly, it took me a while to figure out some of this. I was calling it the same thing for I don't know how many years. So if we just follow through this life cycle, and then I want to kind of show you some of the pain points, and then I made a companion document that tells you where to go to examine each one of these pain points. So on the left, there is your agency. This is assuming your agency has their own system. There are still things we'll get to in a few minutes. If you don't have your own system, then you're going to end up skipping ahead to where everything is blue. But for right now, we're going to start with you have your own system. Doesn't matter what vendor. You have your ePCR system and you're sending data from your system, or you think you are, to AZ-PIERS. This is kind of how it works. So you'll see there's an arrow. Maybe I need to make those arrows bigger. That's going up to the right from agency ePCR system to export criteria. That's what I was just talking about a moment ago. If your export criteria that you have set or your vendor has set or whatever, somebody set at some point are not met, they're not processed for export. They don't go anywhere. They don't leave your system. They don't even start exporting. So you don't get messages back from your system saying something failed, nothing. Something failed because it never started. If your export criteria are met, and I'm not going to know what those are, so that's something you guys got to answer for yourself, which is one reason it's important to review it. I'd say at least annually. It will go over, and this is kind of simplified, but it will start building the file you're going to export. If you've ever looked at a file that came over, it's an XML, which looks, if you've ever accidentally clicked on a web page and had the whole thing come over to the right and it looks like gobbledygook, that's HTML. It looks a lot like HTML. But that, you also notice if you ever looked at your XML file that there's a lot of codes. We don't get the words. So you could label a value what you want. We're going to get the code and we're not going to know if you labeled it something completely different, which is why we advise not to do that. Except for things like narrative where we actually get, it's a text file. So we get that paragraph or whatever you're sending it to us as long as you're sending it to us. But that XML file is built at that stage as long as it meets your criteria. At least that's a good way to think about it. This is another pain point. That's where the red stars are, because red seems like a good pain color. If that file is not being built with all of the stuff that's supposed to be sent to AZ-PIERS or wherever you're sending it, even if you're collecting it, if it's not in there and I don't get it, my system doesn't know you have it, and it's going to say you don't. So that's another place to really look and try to identify. And that is the issue that we had when I mentioned earlier how we had to update our state data set because there were some issues with it. The 3.5 data set, it was posted at EMSRUG, and I believe that it was not giving the vendors the correct information if they were downloading that to build their exports. So that should be fixed now. And thank you to Zoll and EMS Charts for slogging through that with me. That was awesome. And EMSRUG also did a bunch of reviews, and Image Trend had to rebuild the whole thing. So, but that just shows like it's the kind of thing where I'm not getting it. You're sure you're filling it out. If it's not in that file, I'm not getting it. Another example is we have some required custom elements. You'll hear this term a lot. So a lot of the opioid overdose elements, if you're filling those out, if it's a suspected opioid overdose, if you don't tell your vendor to include those, they probably aren't going to because they don't send us everything. There's just way too much. We don't want everything. We're happy to take whatever you want to send us. You don't have to take things out necessarily, but custom elements are the kind of thing that if you don't tell your vendor you want them included in your file. Hopefully in 3.5, you can just go by our data set that we put, our state data set file that we put at EMSRUG. That's one reason they did that, but just, you know, that's a pain point. So that's a place you need to look. If you're getting validation scores back and things are weird, or if you're getting failed reports back, or your numbers are low, it's not exporting at all, we're not getting it, and you're not going to get messages back. Okay. So then it goes, once it's built, it has to pass through the EMSRUG schema, the EMSRUG schematron, and the Arizona schematron. And I'm later on going to work on a graphic that kind of explains what these are, but just think of them as filters, quality checks, format checks, like the NEMSIS schema. If you send me a text field and the NEMSIS schema says it has to be a string of numbers, the NEMSIS schema will not send it. It will reject it. It'll say this isn't the right format. Sometimes it's even something you wouldn't have had to send me, but if you're trying to send it to me wrong, it'll kick it back to you. It won't send it out. So your exported file is built, but it doesn't actually get exported. It fails to export. At least that's what it should say. So it should fail to export. I don't know how each system displays that. I know in the state system where I can look, I also have a couple reports that I've built that I can run, but just make sure that you have a place that you can look, and see what stuff has failed to export. Because once again, I won't ever even give you this back in a failed import file because I'll never get it. It stops there. It never leaves that little orange area. That orange area is all of your system, your vendor, the stuff you see and I can't. If it passes through the NEMSIS schema and schematron, then it goes on. That's my little ePCR. So it's a little ePCR now with all its little coding. It gets sent out. It makes its way, hopefully. And I guess that's another pain point I could add in if you're not sending it to the right place. But it gets sent over to AZ-PIERS or whatever other system you're exporting it to. And it's going to assess your access. So there's these codes you put in there. The system goes, oh, this code means this agency. This agency is using this import tool. That's allowed. We recognize that number. Many of you have probably worked with me when we don't get your stuff because the wrong agency number or wrong state unique ID is being sent over. And so it just says, because it's a fail-safe also to make sure that, and because otherwise it would have happened. There's a couple cases where someone was trying to send to the wrong account and it would have gone into the wrong agency, which is a huge no-no. So it assesses whether or not that ePCR should have access. The system is sent over with right identifying information. It also passes through on our end, the NEMSIS schema, schematron, and Arizona schematron. And you're like, why twice? Very inefficient. Well, I do occasionally update our Arizona schematron. NEMSIS occasionally updates their national schematron and national schema. If for some reason it happens, you have not, depending on if you do as an agency or your vendor does it or whatever, nobody knows to do it if someone's left. If you don't update those orange boxes, the NEMSIS schema, the NEMSIS schematron, and the AZ schematron on your side when they're updated, you will have an old version. It is possible that you've passed it through your version, everything looked fine, it sent it out, but then when it gets to mine, it's like, we don't recognize that code. That doesn't make sense. That's not within the current rules. So it still has to go through mine. That's not a choice. That's just how it is. That's how the NEMSIS standard works. So I can't decide not to have a schematron even if I wanted to. If it goes through that process and to the left, you'll see that not met. That means it failed to import. On your side, it'll probably say failed to post. So luckily there's two different terms. So export means if it leaves your system successfully. Post means like when the mailman tries to deliver it into your box. If you've taped your mailbox shut, or I've taped my mailbox shut because it doesn't match what it should be, it's going to fail to post. It's going to get sent back to you. There should be some kind of message coming back to your system, whether you see it or not, and that's something else to ask your vendor if you don't know where to find these, where you'll be able to see, oh, it exported just fine, but it failed to post. And it's essentially the same thing as I do not get it. The only difference there is I can kind of see when that happens. Well, I can see when it happens, but I can also create a report that catches most of them that sends it back to you. That says, that's when you get those failed reports, that's what happened. It failed to post. I got it, but my system had to reject it. And, there's various reasons for that. Sometimes agencies never get these reports from me, and that's because you've never had anything fail, and it probably means your schematrons are updated on your side. And so it's rejecting the export before it ever even sends it to me. Okay, so that's when those messages go back. You see a little arrow and a little white box says error sent back to the ePCR system. That should be automatic from AZ-PIERS. Elite system should be sending messages back to your vendor, no matter what vendor you have. But I can't tell you because I don't know where you would find that information in your product. But that's super important to track because if you fix them quickly and get them to me, you'll never get those reports from me either. Okay, so I'm going to keep going. But before I do, I want to just pause for questions before we go to the second half of this little handy dandy.
Am I showing the right?
You are. Yeah, you're absolutely showing the right one. It worries me if you didn't know that when I was talking about it. I'm like, I think it's okay. I'm sure I'll need to make this pretty. I'll assess with people that actually have design skills. I mostly just don't want the colors to all match each other because then it's really hard to keep track of. All right, so let's say that you're at the point where it passed. Can you scroll down just a little bit?
Yeah.
Yeah, show the bottom part. Okay, great. So it's passed. So see that arrow there? There's the 4 stacked blue boxes or purple blue boxes. And at that point, if it passes, that means it's imported successfully. So it has gotten through. Yay, yay, super important. Once all of that happens, then it runs through the validation tool. So when you guys get those weekly reports, which hopefully you're getting, the ones that have, you know, we call it a validator, but it's also called business rules in the general world. It goes through and it looks at all the things you've sent. It's within the basic structure, but it starts looking for, you know, you didn't send me this data element, but we're asking you for that. Or you said this, but then you also said this, which doesn't make any sense. Or your time's out of order or whatever. That validator runs within the AZ-PIERS system. So it already has to make it in for that to even happen. So if it's not on your validation report, it doesn't necessarily mean everything's good. It just might have never made it into my system. I also kind of tagged on, so AZ-PIERS is that pink lavender-ish box that says AZ-PIERS. Above it at the top is report writer. So report writer is part of AZ-PIERS. It's actually kind of comes out of a different site called Datamart, but that information makes it into AZ-PIERS. It's imported, including all the validation issues, and you will get those reports hopefully sent back to you automatically. I've set them up, and if you don't get them, let me know, because either they're going to maybe somebody who no longer exists at your agency, and they're scheduled and they're sent automatically. And then also those failed reports, all that information comes out of report writer, and I create those and send them back. So once it's in AZ-PIERS, even if you've gotten stuff back, if you got reports back saying it's failed, obviously it doesn't go anywhere, but if you've gotten stuff back saying that there's validation issues, it still is going to continue to go on to different areas. And Shelley, can you scroll down just a little bit, please, so we can see the bottom more? Okay. So some of the places your data goes is our trauma registry, also called the Arizona State Trauma Registry, or ASTR. Sometimes people call it Trauma One because that's the name of the product. We send data to the trauma registry, and they send data back. Recently, because when we went to 3.5, the current product we use for trauma registry doesn't work with 3.5 data. We are eventually going to have that to the point where we will be able to exchange data again, but we have been exchanging data, and we will again in the future between the trauma registry and the EMS registry. Also, for those agencies that have opted in to the statewide HIE, so not everybody, but if you have opted into the statewide HIE, we send your data over to the HIE, and the HIE sends back outcome data if it hits a record on a hospital site, because all the hospitals also send data to the HIE. And then, and those are two-way arrows. I probably need to make my arrows a little bigger. And then the data from AZ-PIERS also goes over to Hospital Hub and Elite Viewer, which is pretty similar, but basically that's where hospitals can go log in and retrieve PDFs of the ePCRs you've sent. I know I'm always saying, like, so for that hospital to see that PDF, it has to have actually successfully made it into the database. And this is a whole track of what might happen if it doesn't. So it has to be there. And then it has to have the correct facility ID code, one that's linked to licensing, because that's really how the system, not the name, identifies what hospital it is. We don't make you guys match the name. A lot of states do, but I don't at this point really care if you call it University Medical Center Phoenix, Banner Good Sam, Banner Good Samaritan, Good Sam, but I need that code. It's the same code no matter what. And that's how it allows that's how the system knows that person that's linked to that hospital on the hospital side has those permissions, is able and should see that record. If you have a base hospital logging in and you've given them access directly to the system and they can see all your records, that's a totally different thing, but okay. And then this is where also if you use the system directly, this is something that could be something you need to address or will be asked about later. And then everybody else also that sends us data. So then the data is sent to, on that top line, it says NEMSIS schema, NEMSIS schematron. So there's a national one. We send data to NEMSIS. It has to go through their national schema and schematron. Not all your data is sent. It's a limited data set. There's no patient name. There's no patient date of birth or anything like that. There isn't an agency name, but they do take a set of our data. And if you're interested, it's on their website, and I can also try to post it on ours of what specific data elements they take. But anyway, if it gets through their schematron, then it goes to NEMSIS. If it's not met, it fails to export from our system, or it fails to post. It depends. So if it's hitting our schematron on the way out, it fails to export. If it's hitting their schematron on the way in and they're finding a problem, we should have matching ones, but if for some reason we don't, it would fail to post. And if you guys have had all your coffee, I don't think I would have figured this out by this point in the presentation. I not worked with this for 10 years, but you're probably thinking, why the heck would it fail to export or post if we've already gone through that whole schematron process at the beginning before it went into AZ-PIERS? How would it get in? If it fails later, why did it get in the first place? It shouldn't. There's a few reasons, but one of them might be if you enter into the system directly and your ePCR never imported because you're entering it directly in. If it doesn't contain all of the information that is needed, or it's got issues with, like I said, you put a text in there and it's supposed to be a number. It shouldn't even allow you to do that, honestly, but then things can fail to export. If you're missing a mandatory element, you're not filling it in for whatever reason. I mean, your validation score will be awful because the validator runs as you're putting data in, but it also will fail to go to NEMSIS because NEMSIS has a minimum standard that has to be there or they will fail it. So this is my diagram that I made, trying to explain kind of the process of data where I have found areas where it could fail. When agencies say, okay, why is my score low, or why is this or that? I mean, yeah, sometimes it's not getting collected, but a lot of times it's honestly more these issues. It's getting in, but not all data elements are supposed to be sent are being sent, or they're not sending in the proper formats, they're getting rejected, things like that. And then, Shelly, can you open up? There should be one more PDF in there. Let's see, what is it called? Called Data Quality Protocol. I'm not going to read through this whole thing, but it's going to be posted and I'll just skim through it. So we'll have, if you look at this infographic as it is, and that's okay. You're fine. So I have like a text document that kind of goes along with this.
The summary? No.
No, it's called Data Quality Protocol. Is it not in there?
Yeah.
Okay. Like I could have not copied it over. Thought I did, but never know. Okay, so I promise we will not read through this whole thing, but I just want you to know this is like a companion document that's going to go with it. So it kind of walks you through. You're looking at this diagram. Hopefully it kind of makes sense. I may need to add more things to this explanation, or maybe put a sheet directly with the ePCR life cycle for people that weren't on this call. But it says, you know what, okay, so if you have an issue like the ePCRs are not getting to AZ-PIERS, that was a couple of those little stars, those red stars on that diagram. It'll tell you, check your expert criteria, check for any failed posts or failed AZ-PIERS imports. You guys have access to AZ-PIERS too. You can check, actually, you can go into your agency on our side and see if anything's failed to import if you want to. You have access to it. If you don't, let me know, because you should. Also, check your runs per month report. Now, we've talked about these reports about 1 million times, but if they're missing from that report, if the number doesn't look right, it's because we're not getting it. And everything is supposed to be sent to us. So we're supposed to get every single ePCR that you put in there. I'm sure somebody could think of an exception. I know I had one agency that inadvertently was getting some hazard exposure data for their crews entered in. Obviously, you don't have to send me that. So every, EMS run, even if it was canceled, call. But and then as far as validation issues, just check your validation error frequency by and with incident number report. If that doesn't make any sense to you, it is because you're probably not getting those reports weekly and you need to let me know, but you should be getting a weekly report that looks back 2 weeks. It gives you a frequency. And this is, we went over in this last meeting too, but we've got links later on in this little document. It's only one page, don't worry, that link back to the tutorials that show you little screenshots. But that, along with the CSV version, which lists every single incident number with every single issue, so you have some examples, that's what you use to go back in your system, say, okay, this doesn't make sense. My data is absolutely there. And then you can go, okay, so the data's there. So go through that chart and go to those pain points and determine where the fail is, what's going on, why is my system saying that it's not there. That's not gonna be failed stuff though. It's only stuff that's already made it in successfully. And then Matt, do you have a question? And then we can go on to the rest of it. It's only one page, I promise. It's not bad.
Yeah, thanks. Sorry, I promise I'm not usually this needy.
You're fine.
I've been finding those Excel spreadsheets super valuable because it's been great to be able to go back and like look at the charts and see if the data is actually there and like where the problem lies. I'm wondering, is it possible to get you send out like a monthly like score essentially, you know, like your 90%, your 40%, whatever. Is it possible to get those like more frequently? Like we're making lots of changes right now trying to deal with issues, and it's like hard to know, like I have to wait like a whole month before I see a change.
You know, that's a good thing. So absolutely, yes. I build each one. It's not very efficient. I build each one individually for each agency. There's a reason that I do it that way, but it also means that I've got 500 reports, I think, that run. So I can do it on an individual basis. If your agency wants it, I can set up one that's basically the same thing, but it runs like every week and only looks back a week or something like that. The other thing I can do, if there's a bunch of agencies that are interested, is I can set up a report in our report writer that you can run on demand because you have access to the report writer. I'll write a little tutorial of how you get in. It's really easy. Go to tools and then report writer. You could actually just run that report on demand and you could do the filters. And I just build it so it makes it easy. If there's a lot of agencies that would like to do that, because it would take me so long to build an updated report for each agency. I'm happy to do it, but it just wouldn't happen very quickly. So yeah, either one of those is fine. If other agencies are interested, I can just create a report, share it with everybody who has access to report writer. It would only run on your own data, don't worry. So, you know, nobody would be able to see each other's stuff. Because the system is at least smart enough to know what you have content rights to.
Yeah, I would be happy with either one. It would just be great to get like more timely updates to make sure that I'm making the change and they're actually making a difference.
Okay. Maybe Mary will help me. So, okay. Update validation report. And then just, Matt, since you asked, are you thinking, would you want it run like for the past 30 days every week, or would you like it run? I would think you'd want something run like every week just on the past week's data or something.
Yeah, that would be fine. And then like the monthly one could be like the bigger one that looks back, you know.
Okay.
Whatever.
And I'll make an on-demand one too. I hardly ever do that, so I got to make sure I do it right, where like I don't accidentally make it where someone can. I just want to make sure it's save as, so no one accidentally does something funny. But that way you guys don't have to depend on me, which is the best thing. If I'm not around, or I don't know. Okay, I've made a note. And then if there aren't any other questions right now, we'll just finish up this document. And then I think we've only got one more thing after that to cover. Okay, so how-to checklist, which I know isn't really a checklist yet, but this was the draft that I got as far as I got with it right now. So check your expert criteria. We talked about this on the picture, but it just walks you through what does that mean? See if it's getting exported. Review it with your vendor. Make sure that you're having it default to send within 48 hours, no matter what. Don't make it wait on something that may never happen. You can always resend it, and that's something else you need to talk with your vendor about, making sure you set that up the way you want it. And kind of a why this matters. I think it's really important. You guys, most of you probably know why this matters, but it never hurts to kind of point out that for some of these, for example, will not know there's a problem until months later when we realize numbers are low, or like I had one agency where we realized it looked like they were transporting 100% of their patients. They obviously weren't. What they were doing, and they didn't even realize it, was only sending me transports. But by then we're 4 months out, and you know, maybe that's something we now know to catch, but it's the kind of thing that you guys would know. When you look at your data, you would know if something is far lower than normal. But by then that data has been sent, it's been sent, you know, it'll resend an EMSRUG, but it'd be better if we didn't, you know, have to send them 4 months worth of old data from before because it was never sent in the first place, those kind of things. And then check any failed reports. So there's a link here where it talks about, there's several links. Hopefully they work. They link directly to our public facing website. I've had these tutorials posted for a while, and it walks you through with little screenshots and arrows exactly how to use the different reports you're getting. It's really not painful. I mean, They're probably pretty detailed because first time around, it's nice to have detail, but it's not like something with a lot of steps where you'd have to memorize it. It just kind of shows you, okay, this is what this represents. This is why we built it and how we would think you would want to use it to solve these issues. If you have things that I've put out there and you think I should write a tutorial and I didn't even think about it, please let me know. Totally willing to do that. And that's, like I said, I won't read through this whole thing, but it talks about for all of those issues that we talked about on that graphic that I made, not only why they're important, but where you can go to get specific directions and how to do that. Once again, I don't know how your system looks on the inside, so I cannot give you a tutorial on where to look for your criteria or anything else within your own system. But I can show you at least the parts as far as the reports I send you and the parts in AZ-PIERS that you have access to that you can look at and review. Hopefully make it where, you know, I use the word empowered. I don't know if that's really appropriate, to empower you to address your own data issues, because I am not the queen and I'm not in charge. And I would rather not be the one, you know. It's great being needed, but I feel like I end up holding people up a lot if they have to wait on me to find things for them. And I'd rather give you guys the tools to find it on your own. But I'm happy to help you. Don't feel like that means I'm telling you to leave me alone. Okay, I think that's it for this. Oh, I have one more thing. Can you open up, and this is going to be, when someone asks if this is posted on the website, none of this is posted yet. So one thing you get when you show up to these meetings, for the most part, is you get to see all this stuff first, and later we post it. And then there is one, I think I put it in there that, oh, maybe I didn't. I think I did. Talks about blood glucose.
Yes.
Okay. So this one, if you guys have image trend, pay attention. If you don't, you can take a nap for a minute or get a cup of coffee really quickly, because this isn't going to take very long. So one of the issues we've come up over and over and over and over again is we have a validation rule looking for various things. One of them was looking for blood glucose. In 3.4, you could only record a number. Okay. And there were actually instructions in the data dictionary from NEMSIS that said, if you have a scale that does high, low, or you have one of those monitors or whatever that after the numbers, it just says high or low, maybe it only says high or low, use this number. And if it says low, use this number. Well, NEMSIS updated, because it's something that obviously was needed. They updated the standard for this element, eVitals.18, to accept the words high, low. So that whole thing with the NEMSIS schema, if you try to send the word high or you try to send the word low, it should actually go through, not just the number. But that wasn't happening in at least, and I don't know with other vendors, but at least with the image trend system. So image trend made a fix, but then I don't think there was very good documentation that everyone should do this. So I copy pasted some stuff. I will post this someplace, and it is within the Help University. So there's little things that say, you know, log in, go to Help University. On the main screen, click NEMSIS 3.5 transition. Under 3.5 transition tools, scroll down to agency tools and click on the bullet point step-by-step guide to NEMSIS 3.5 transitions for agencies. Then scroll down to step 5, part 1, number 9. So they are going to put out a bit of an easier to find reference point. I mean, there was a lot of stuff when people transitioned to 3.5. It's all there. That's great, but this is not the most intuitive thing to find. And, you know, I think they're going to put it someplace a little bit easier to find, but this is the exact instructions on how to deal with that issue. So you need to add a certain, and this is where I start getting out of my depth. You have to add something called a certain control. So you have to, and I put bolds and highlighted, if you want to collect high and low and not have it fail when it sends to me or subtract a score because it's looking for something and it ends up blank, because that's what was happening. And don't collect it in itvitals.018 because we don't look at that. And it's not to be mean, but I mean, we can't look for things all over the place all the time because it just doesn't make sense for us not to include something in our data set, but then look for it there. So if you add this control, it should then allow you to document the high low in addition to the numbers and then send it to our system properly so that we get it within eVitals 18, which is where we are looking for it. So this will be posted somewhere. Ooh, lights went out.
I haven't moved in an hour.
There you go. That means we're done. No, just kidding. So that's it. Okay, now, anybody who doesn't have image trend can now come back for their coffee break. But I got enough questions on that over the last 6 months that I felt like it was important to try to address with the group. Okay. Lastly, and then I think we'll be done a little early, I wanted to just point out a few things. Can you, oh, Shelley, can you let me drive?
Yeah.
All right, let's see. Present now, and we'll see. Okay, I can share my, and then I'm gonna go to some tabs and we'll see what happens. All right. I was gonna ask if you can see my screen, but I can see if I can see my screen, so I don't need that. Okay. So the last item before we say open forum and adjournment, I wanted to point out where some information was on our website that are some really cool EMS data reports. Not just the ones we talked about in the statutory meetings, but I'll show you those too. I'm not gonna walk through them all because that would take a whole nother meeting. But I want to show you where they are so that you can find them. It will give you ideas, maybe on something you want to look at, something you want to show somebody. They're just really cool. So if we go to, I'll show you where this one is and then I'll open it. If you go to, I bookmarked my own site. So this is the AZ-PIERS one, but you would navigate to the Bureau of EMS and Trauma. And then under the data quality assurance section, there are several options. And one of them is, oh, and there's a share thing there, see? Okay. One of them is reports and publications. There's all kinds. There's our EMS annual reports and a snapshot if you didn't know where to find that. I know we've gone over those in some of the other meetings, different ad hoc reports and publications. And we have one that says national reports. And we put several things here recently, in case you're interested. I don't think we've talked about it in the other meetings, but we have a report that we do, it's called Collaborate Appropriately Enough, that was done in conjunction with our vendor, and most states have the same vendor, not agencies, but since it's a state report, it kind of makes sense. You can kind of see some of these really cool annual reports. I'll pull one open just for interest. And then EMSRUG, which we also mentioned we send our data to, they also have an annual report. There's links here, but if you go on the EMSRUG website, there are not only these reports, but tons of dashboards. Some are public facing, some are for EMS agencies. They're really well done. They have not a huge staff actually, but they have some very, very talented people that do Tableau there. So this is like, I'm just gonna page through. This is some of the data that's available on the EMSRUG report. Sometimes it is nice to be able to see what numbers are nationally. And I get asked about this every once in a while. Maybe you'll see something on here and you'll say, I would really like my state to do this kind of report. And more than likely we can, because since we send less data to EMSRUG than what we get, we should have all of the data that they are using, unless they're linking up with the national. I think there might be at least one where they're linking up with the national database, and then we may not have that one, but okay. So I just want to show you, this is there. It's some pretty cool stuff. And then one of these reports, the 2023 Collaborate report, there is a lot of information here. They also go through exactly how they did it and how most reports do, and exactly what they use to do it. If you would like, you're an agency that has the resources, if you'd like to try to replicate it or yourself, you should be able to from these. It doesn't matter what your vendor is, because it's just all using the same EMSRUG data points that we're all using, which is one nice thing. But let me go. And your vendor may actually put out something like this for you too. I don't know, but I wanted to share, since this is a statewide one, and then some of it is national. I think this one's mostly national based. That there's some cool topics. Once again, something you might want to look at, or you might say, I really want Arizona to do this for Arizona. Let us know, because Vatsal's always looking for ideas, begging for ideas, trying to like pinch people to get ideas. So especially if you can find something on this that we know, we don't have to say, well, that's not, we don't collect that, there's no way for us to look at it. I'm sure she'd be thrilled. We might even be able to do it by region within our state. She's not here, so I don't know if I can say that, but I'll look at Julia. And Julia, she didn't nod, but I know she means to nod. Just kidding. But there's just a lot of really cool information. I mean, I know you guys don't have a lot of extra time, but maybe if you have some time to take a look, there's behavioral health information, and that's looking at the, multiple years, 20, 21, 22 over COVID. I mean, it's some really cool stuff. And we do not necessarily have the time to do all this stuff all the time. You guys don't have the time to do all this all the time. So if someone else has done it and provides it for you, it's something interesting. They had a quick facts report that shows national lights and siren usage. That's kind of fun. Also, their graphics are really pretty. And then I know you guys have seen this, but I just have to show you on the data visualization. So that was that page again where the data quality assurance on the Bureau of EMS. I won't go through all this because you've probably seen this at the other meetings, but there's a little snapshot here. You can look at fall incidents. Some of these are trauma data, it will say, and some of these are EMS data, but like here's EMS stuff. And I don't know what current year. I think she wouldn't have 2023 up here yet. I don't. Yeah, so you can filter by 2020, 21, and 2022. And there are other, you can adjust by EMS region. In case you're interested in seeing what the northern region has according to the data that you all send us. And then what type of agency it is, air, ground. You can't dig down obviously to like the county level. I don't think on any of these, and definitely not the zip code level. That would be too, in our public website, we can't show that in case it might indicate patient information. Still, there's some pretty neat stuff. Once again, you can filter by, obviously these are categorizations of impressions, which is why it's super important if we could please get not just, my least favorite is, I don't know if they even have it on here, weakness. I realize that that's actually, it makes sense because a lot of people are weak no matter what's happened to them, but it doesn't really help us do a lot with the information you're getting back. It just gives you an idea. And I know if it's not on here, I know that we do have available exactly what was included in each category and that kind of thing. She might have that in the introduction here. I don't know. Okay. And then one other thing. BEMSTS website. If you haven't checked it out, you should. There's a lot of really cool things, including a data dictionary for 3.5. You can scroll through. That's like a web one, so you can instantly find stuff. But they have public dashboards and also EMS agency reports. And there's some really cool things that you can look at. There's a data cube available that you can play around with. And let's see. I haven't looked at the public ones in a little while. There's some federal ones. I don't know if this is where they put the heat one. Okay, yeah. This one, my only caveat is when you look at it and then you're confused because it doesn't look right for Arizona. They don't have the 3.5 data in here yet, just 3.4. So 3.5 will be added to it. But since we had a lot of our hot time this summer when agencies had moved over to 3.5, just keep that in mind when you look at some of these, but it explains how they did it. There's an opioid overdose tracking dashboard, and this gives you 911, dispatch complaint, basically, performance measures, STEMI, naloxone, motor vehicle crashes, and data quality, if you're interested. That's what I look at. But now there's an intro video that walks you through things. There's a companion document that explains, kind of how to use it and what they did. And it's all based on you guys' data. Arizona would be, I don't know, I think every state right now reports data to Nemesis, but when they didn't have them, it would have been, gray or whatever color they make it when you're not getting. This is all due to the data you send us, the data we're able to send on to them, and they're used to make decisions at the federal level. Everything from kind of looking at the impact of extreme heat and opioid overdoses and everything like that. So it's really, really important, even if it's just one ePCR out of a million, it absolutely gets used in policy. And I actually know how to say that. Anybody else from the Midwest? That's Menominee. I'm from Minnesota. If you guys didn't know, if I hadn't said that before, my accent doesn't come out. Menominee. It reminds me of the phenomena from the Muppets. Huh?
Next door to Marinette.
There's some cool stuff. You can go down rabbit holes. There's a lot of things to check out, but I wanted to point out some of these resources. And like I said, please, please, please take a look. If you think things cool, let us know. And we will see if we can do it for Arizona or maybe by the regions. Because although, Vatsal's, she's always got 17 things going on. If we think it's actually useful to you guys, we will make it happen. That's what we want. We want something that not only can make an impact, but will actually give you the information that you are interested in seeing. Okay. I always think it's gonna be like short, like an hour, and here we are. It's almost 2 hours of me talking. Next time I'll know, just have half an agenda for an hour meeting. Okay. So that is pretty much it. Right now we are doing open forum and adjournment. So open forum is just if you have anything you would like to ask that we can address on a phone call like this. Like I don't want to look at anyone's personal data on the screen. Or questions for the group. You have a suggestion. When we did that survey, some people said, let's do this kind of thing, but I need I always ask for agenda items, and so far, I think I've only ever in 10 years gotten like 3 people who've emailed me with agenda items that they would like me to have. So this is a good time to tell me or tell me later, because I don't know what you want to hear, and probably not just me talking the whole time. And then we'll adjourn. So are there any questions, comments? This will all be posted. I don't know what we do without Shelley. This will all be posted on our website in a timely manner. Hey, Bill. Go ahead. Bill?
Yeah, I'm here. Can you hear
Okay,
me?
great. Yep, I can hear you.
Sorry about that. The only thing I wanted to remind you is we still cannot get ImageTrend to come up with a solution with those endpoints between agencies. I know you've written a ticket, I've written tickets, and they just seem to
I
float
think that's the one I just responded to something, and I don't want to imply that I've been on the ball lately because I've been buried, but I did just respond to something from Tony, who's taken it over.
Okay.
That was the one, and I just responded to him on like Friday, I think it was. I don't know if anybody else was working on Friday, but I got a lot done because nobody else was working on Friday. And he was looking into it and he couldn't figure out why I had set something up the way I did. And I found the original email where they had requested I set up a certain way. And I think that's related to that. So hopefully he's on it. Tony Rutz. I don't know if you've had interaction with him. It's TRUTZ@imagetrend.com. So he happens to be our account rep also, which we were lucky enough to get due to the fact that we got it with LMS, and I totally stole half of Tony's time because we don't usually get to, because they, cost extra. So let me follow up, see if that was the one, but if not, yeah, absolutely. We want to keep on top of that because that's something that needs some attention.
Yeah, the biggest thing is I can't do anything with it. The other endpoints I can change, but I can't do the
Yes,
agency
I cannot.
to agency.
I can't either unless they've changed something and I don't. Sometimes I have to give myself permissions to do something, but I don't realize that. And I don't go in to give myself permissions to be able to see something to change. But last I checked, that wasn't something that I could alter either. I'm sure there's a reason. I'm sure at some point some state data manager deleted something that was vital or changed it and caused a big problem. But yeah, I don't think I can fix it either, but I will ask about it. So make a note. Endpoint. Okay. Conrad, do you have a question?
Yeah, I was just curious if there was any other discussion on some of the validation rules that are at state level that are tied to basically all call types. For example, we see the 12 lead is required, and some of our non-emergent interfacility transports, it's requiring certain things that, like the 12 lead, when it's really appropriate. Has there been any more discussion, or has anybody else seen that issue?
I remember talking about a couple rules that revolve around this. Have you updated your schematron in the last month? Do you know of?
I believe I have.
Okay. Is it showing up on your side, or is it also showing up in the reports you're getting back?
It's just showing up when we're entering the
Okay.
reports. It's getting flagged. That's how I
Send
know.
me just send me an email with the ID number, that is in the message of the rule. Because when you import those, it creates your own ID number, and that one I can't reference, but if you look within the message, if you're getting it back from my system, or even if you're not, if you put it in yours with that same, they'll say like rule ID, whatever, in the error message or the warning message. If you give me that, I can kind of take a look. I know that in the last schematron, I updated a couple, I inactivated a couple, and then also, is it orange or red?
Red.
Okay, so yeah. Let me look, because there were some that we were working on and we need, but I think I finally just thought, okay, for now, we're gonna have to put that on hold and go back and deal with it later when we figure out why it's triggering the way it is. But we've got, I think, like 300 rules or something, and so I don't have them all memorized.
Mhm.
But I know that this and the blood glucose, and I think there was at
Yeah.
least one other one, has been coming up frequently, so
Yeah, the two for us have been the 12 lead and the blood glucose for different primary impressions. And my recommendation would be just to simply add to it if it's any kind of 911 response versus medical transports or interfacility transports. It might help to eliminate that.
okay, yeah. And that's something else, if you can put in the email, like your suggestions.
Okay.
There are definitely things that can be tweaked on these because we added some rules for 3.5. The rules aren't necessarily checking anything that we maybe shouldn't have checked before, but they're gonna more likely have performance issues because they haven't been with us this whole time.
All right. Thank you.
Right. Is there any other questions? Shelley, do we have to do the thing where we do motion to adjourn? Okay.
No, we don't have any voting.
Okay, so thank you everyone for attending, and hopefully the caffeine kept you awake. Send me an email if you have any questions or anything like that. I'd love to try to address them. If you have sent me an email and you haven't heard back from me in 3 weeks, I will never be offended if you send me another one to remind me. I try not to get that far behind. And I already have in my head 3 things that I owe people from about 2 weeks ago. So I don't want you to always have to follow up with me to remind me, but please do so if you have something so it doesn't stay on your plate if it could be on mine.